Professor Ash, my name is Emily Dunning, and this is my aseptic sterile technique video. This is my patient. His name is S. Punj, and he has a laceration wound, which we're going to be taking a look at today. So we'll get started. I'm entering the room, I'm sanitizing my hands, I'm saying hello to my patient, introducing myself, my role, explaining the procedure, gaining permission, and then IDing the patient using 2 patient identifiers, so name, date of birth, and then checking his ID bracelet. So now that we've done that, I am going to don my PPE. So I'm wearing a mask with eye protection, because we're working with irrigation. I'm donning clean gloves, and I'm going to get started. Okay, so first off, I'm taking off the bandage, and I'm taking a look at the bandage. So we're looking at drainage color, odor, amount, and for this one we'll say it's scant serous drainage, which is pretty good for laceration at this point. And we're throwing this out in our non-sterile garbage. I'm taking a look at the peri-wound area and assessing it. It looks like there isn't any redness, any edema, no ecchymosis, no excessive drainage that we can see here, and no, well, the wound isn't approximated because it is a second intention wound. Okay, so we'll get started. So first off, I'm going to put this under here. And note that we probably positioned our patient in a way that would help gravity when we're irrigating, or gravity would help irrigation. And I would have opened this fully, but we are working with very little space, so we're going to keep it like this for now. And now that I've touched the wound, I'm going to take this off. I'm going to sanitize my hands again. I'm going to start to assemble my fields. First off, I'm going to put these over here. Okay, so I checked the bag and made sure there are no tears. I've checked the expiration date on the bag, and I'm going to take it out. I'm going to use this as a garbage with my tape. I've also gotten extra pieces of tape and put them along the table so that I'm not worried about that later on. And this is now my garbage. Okay, so I've already accumulated all my stuff. I'll go through it as we go. So first off, I'm opening my sterile field away from me. I'm going to put it way out there, pulling it this way, this way. I have my transfer forceps in here. I'm going to actually use them right now to square off my sterile field. Okay, so I'm going to put my transfer forceps here. We're going to get started. So I am going to take out some stuff. Actually, first I'm going to move this out of the way, because it always gets in my way. So put it there for now. And I have my 30 milliliter syringe. So we're going to open that banana peel. Put that in our sterile field. Okay, throw this out. I have my blunt needle. Throwing that out. I have my combine pad. I'm going to do that last. I have my suture removal kit. So I'm just going to grab these with my hands because they are not sterile there. Throwing that out. And then my combine pad, I guess I'll do now. I'm going to pull that out. Okay. I'll put that here for now. Throwing that out. And we're going to do our saline. So first I'm going to clean the lip by pouring some out in our garbage over here. Okay, and then I'm pouring it into our sterile field at a good distance so that it doesn't splash. Okay. And then lastly, I'm going to put this out of the way as well because it's just going to get in my way later. We have our ribbon gauze. That's a lot. Okay. We've done that. I'll actually just push this back in because okay. I'm putting that out of the way. And then I also have my cotton applicators. I'm going to do it with gloves before I put on my sterile gloves right now. So I'm sanitizing my hands again. You always do before you put on gloves. I am putting on clean gloves. Okay. And I am going to take this, actually, first off, we're going to take out our packing. And now we're going to throw away our transfer forceps. They are now contaminated. I'm looking at the wound. I'm going to palpate. There's no excess discharge. I'm going to take this, the applicator. I'm going to measure depth. That, like that. Okay, and then check it on this. So the depth was 1.5, the width was 1 centimeter, and the length was 8 centimeters. Okay, and then we're throwing it out. I also checked for undermining, tunneling, and it was good. Okay, so now that that's done, I'm going to take off my gloves and I'm going to throw them out, sanitize my hands once more, and we're going to don sterile gloves. Okay? And I forgot about this guy, so we're going to come over here. Okay. So, I would sanitize my hands again now that I've touched that. And I am opening this up. Opening that up. Now I've set this up so that everything is sort of like in view. I can still kind of see my wound in the corner of my eye. But I'm not letting this touch my sterile field over here. So I'm starting off with my dominant hand. And I go in like this. I can touch just the cuff of the glove. Just want to be careful. These are not the right size for me, but they work. And I'm bringing them in here. I can even pull these down just by the edge there, but I might just leave them because they are fitting well. I'm going to put my fingers underneath there. And again, these are way too small for me. But now that I have them on, I can go like this and adjust them with this hand. Okay, so I have these on, I'm ready to go. I can touch everything I want to, so I'm going to start off with this, and I'm putting it, I would normally open it up, I'm not going to because I don't have a lot of space, but I'm putting it on the patient without touching anything, just like that. I'm then going to draw up natural saline in my 30 milliliter syringe. I want to be careful not to drip. I'm going to attach my blunt needle. I'm just going to go ahead and irrigate. Okay. Okay, so note that we've done it a few times. Gravity is working to irrigate the wound. And you can just set that down. Now I'm going to use these guys. And I'm going to wipe my wound. I might dry on the inside if there's anything pooling. If gravity worked, there probably won't be. So I'm wiping along the edge here, throwing that out. Wiping along the edge here, throwing that out. And now we're going to pack it. So I'm taking my ribbon gauze, and I'm winding it up. On my tweezers. Okay. Now we're going to pack it. It's a small wound. It's a little difficult here. Okay. And my 4x4. Note that we've packed it tighter than that, but not too tight. That it's going along the edges of the wound. Okay? Now that we're done that, we can do the abdominal. I'm going to get rid of these because we are pretty much done with our sterile part of the video. And I'm going to put on our abdominal pad. And then we're going to tape it. Okay, so it's now secure. I might do one at the top and bottom as well. And then because of that, my gloves are no longer sterile. I'm all done. I'm taking off my gloves so I can remove them like this from the inside, outside, like that. And I can just take them like that. And put my finger underneath. Ugh. Again, these are way too tight for me. And throw them out, and then sanitize my hands once more. And that's everything. Thank you for watching.